Tika Ghana play with the champions. You know, there are so many ways to keep enjoying the things you love on MTN just because everything is made simple just for you. On MTN, you get to enjoy convenience when and anywhere you top up your account. Just top up your credit by using mobile money or my MTN app. You can also purchase it from any vendor at the recommended retailer price and get a 100% bonus. Please remember to demand the same value. Retailers who do not comply will be sanctioned accordingly. It's super simple and convenient. That's why we're good together. MTN, everywhere you go. And play with the champions, Betika. The best sports book in Africa is now live in Ghana. Play with us and enjoy the highest boosted odds. Create your own winning combinations with Betika's Fabum Betty. And with only 50 pesos, you can win up to 1,000 CDs daily in our Fala jackpot. Betika means more Sika. So sign up on betika.com.gh and enjoy our fun virtuals and casino games. Betika is registered under the Gaming Commission of Ghana and not for persons below the age of 18. Well, it's time to speak to the Drive Doctor, Dr. Yaw Osafo, CEO of Medicas Hospital in Mampong Equiapim and Medina Firestone. Today, we decided to have an open clinic. Yep, you probably have questions for the Drive Doctor. Well, I'll activate the phone lines very shortly. Doc is here. Hi, Doc. Hi, how are you?
Kwame, I'm good. How are you?
And today you're really looking good. I got to be honest with you. I love
thank
your.
you,
You changed your outlook a little bit, right?
Yeah.
Because you're normally in your fellow Ghanaians outfit, but today looks like IGZ near
See,
you.
your manager.
Well, hey, sir, who's that?
Yeah, with your manager. Oh, Philip has found me somebody.
Oh my God.
You know.
Oh
so
my
now
goodness.
I'm being managed.
That's right. So then your stylist needs a pay rise.
It is a pay rise. I'm here.
Because you're looking good. Anyway, how are you?
Thank you. Well, it's been very good. Very good weekend.
Yeah.
Very good week so far.
Okay.
And, yesterday. I'm glad yesterday is over.
Is it?
Kwame asked me why.
It was Superman's birthday.
It was the Superman's birthday. The only 4-year-old who comes up to his dad and then says, I have a nickname.
Hey,
Now I want to be known as the Superman.
just like that.
4 years.
Just like that.
He'd never watched any Superman cartoon, nothing.
Ah, serious?
At 4 years.
So he
all
doesn't
the
know
other
who's
cartoon
Superman.
characters, he says he wants to be called the Superman. So
The
Kofi
Superman.
Osafo, the Superman.
My goodness.
So the Superman turned 9 yesterday. Let me see if you last week. Oh, to be beside Dad, have you got my presents ready?
Hey.
See this boy. So yesterday, they're jumping up and down, especially when you gave them the shout out during
Yeah.
the show. Oh, you just made their day. So
I'm
Kofi's
glad.
very
I'm so happy.
And he's super excited about his birthday yesterday. He had a good time. So
That's
we all had
really
a
good to
time
know.
having
That's
fun.
really good to know.
But, yeah.
Well, so today as well, I mean, this year we've touched on a lot of topics, and unfortunately, most of our listeners are unable to call in, probably
Right.
because of time issues and all of that. So today we decided to have an open clinic. For people to ask you anything that bothers their mind, any health issues that they have, or any concerns that they have, and if they need clarity on any of the topics that we have discussed here. So if you're listening now and you have a question for Drive Doctor, you know what to do. 0302216541. That's the number to call. Or you can send a WhatsApp message on 055-1111-997. If you're on Twitter, our hashtag is DriveOnJoy. If you're on Facebook, you can check out our live video. I think we're live on Facebook right now. You can put your questions in the comments section and we would address them, okay? So totally activated. But before I get to my first caller, the phone line's activated 0302216541. Any question at all you have for the Drive Doctor or anything you want clarity on, Dr. Yaw Osafo will speak to it. But we probably do a recap of some of the things that we talked about this year.
Absolutely. So good afternoon to all our listeners. And that's what we decided to do. We realized that sometimes the 30 minutes, 20 minutes, Kwame, goes by so fast. So today we're giving an opportunity, and we hope to do this every quarter, give an opportunity to just run an open clinic. If you have any questions, concerns about any health issue, then you bring them up. So Kwame, since the beginning of the year, we've had the opportunity to talk about different health topics. Thankfully, COVID has brought health issues to the fore. So we've talked about blood in stools.
Yeah.
We've talked about gas.
Bleeding per rectum.
Oh, okay.
Thank you very much.
Thanks for the correction.
Yeah. When you're here, you have to use our terms.
Okay.
We're in the medical field. You can't just say blood in stools. You know what I mean?
Okay.
Bleeding per rectum. Thank you
Speaking
very
like
much.
a member of the fraternity.
Yeah, yeah, yeah.
All right.
We move.
That's good.
Oh, say Dr. Alexis.
Well, I have to frame your certificate in your hang
Oh,
it somewhere in the
sharp.
reception. So we did that. I think we also talked about blood clots. One of the sessions we talk about blood clots.
Yeah.
And for me, that was one of the most important topics that I wanted us to discuss: the risk factors, the seemingly very simple things that can lead, to very deadly consequences. So just traveling on a flight, and I think for a lot of us who don't get the opportunity to travel by air a lot, that is sometimes a very wonderful experience, and for it to end with a clot lodging somewhere in your lungs and giving you sometimes a deadly complication, it's very sad. So we talked about DVTs, but one of
Deep vein thrombus. Thank you very much.
Kwame,
Yeah.
what's your offer?
Listen. I mean, guys, let him know. Let him know.
Right, so a deep vein thrombus and its complications. But I think the one that got us a lot of comments and people called a lot after the show was the one on the gas.
On gas.
Gas,
Yeah.
I always tell people sometimes after surgery, abdominal surgery, do you know one of the markers by which doctors will know that you're getting better? And then, immediately after the surgery, they would say, do not eat anything, nil per os, nothing by mouth.
Okay.
Don't eat, don't drink.
Yeah.
For us to take a decision whether you can eat or drink, when the doctors come by your bedside, and they will ask you the question,
Which is?
have you done that thing?
Oh, really?
I say, oh, what is it? Hey, can you crow? Why can't you? So if you don't say, most people are embarrassed by the whole thing to admit that they've passed, some flatus. Yes, when you pass flatus, it tells us that your bowel movements have come back.
Oh, right.
When we expose it during abdominal surgery, it takes some time for bowel movements to re-establish. And once bowel movement is re-established, the evidence is that you pass some flatus, you break wind. So nothing wrong with farting when you're on the medical ward.
Yeah. and since that day, I've been counting.
30. We said an average of 13 times a day. And that's the average. Now you overdose.
I thought the average was rather 30. And yet 30.
And 1 3.
1 3.
1 3. So.
Oh, my average is 30. My average is 30.
Then you have to check your diet.
I need to check my diet.
You need to check your diet.
The beans.
What's the beans?
Okay, so, Doc, we've got a caller on here, so we just go
line.
straight away to it.
So.
Hello.
Hello. Good
Hi.
afternoon.
Good afternoon, my dear. How are you?
I'm fine, thank you. And you?
I'm doing well too. What's your name?
Please, I'm Nana Safwa.
Nana Safwa. All right,
Nana
Nana.
Safwa.
Doc is here.
Yeah. I wanted to find out something. I have a mark in my breast for almost 2 years now. I've seen a doctor, and according to her, she said there is nothing serious about it. It will just go by itself. But next month will be 2 years, and it's still in there. I'm not pregnant. I haven't given birth before, so.
Right. Okay, so lump in the breast. Right. So most of the time, because of all the campaign on breast cancer, I think October is pink October.
Yeah.
Where
Breast
we
cancer
try and
awareness.
globally draw attention or bring attention to the scourge of breast cancer. So sometimes when you talk about something, you want to draw attention to it. There is the danger of creating fear about it. Not every lump is breast cancer. So unfortunately, we don't talk enough about the benign breast lumps, i.e. the harmless breast lumps. So not every lump is cancerous. So there are harmless breast lumps, meaning they don't kill you, but it will be there. It can grow big. It can grow as big as my head and cause you a lot of discomfort. But put that against a lump that is cancerous that eventually may lead to your death if we don't find it out early enough. So when you go to the hospital, the doctor will take a thorough history family history is very, very important in this regard.
Okay.
Because there's a genetic component to this. I mean, Angelina Jolie is a well-known ambassador when it comes to that. And the doctor will make a determination after examination and other investigations like a mammogram, an ultrasound scan, and then even sometimes a biopsy, and determine whether this is a harmless breast lump or a cancerous one. So until you've gone through all of the examinations and we draw a conclusion, not that it will go away by itself, but then he will give it a name and then tell you that, oh, this is a benign breast lump. We can either leave it in there or we can take it out. And then it goes to a pathologist for a pathologist to again examine it. They can do a biopsy, for example, put a needle in there and take a little bit of the lump, again, give it to a pathologist. I mean, the well-known pathologist in this country is Professor Jimambidu Akusa. He and his people, they will look at it under a microscope and then give the clinician a definitive diagnosis.
Okay.
So if she still has doubt, I'll tell her to contact her doctor, her regular doctor. If she wants to give us, get in touch with us, she can also get in touch after the show, and then we'll take her through all the processes of investigating the lump.
Okay. Hello.
Lexis.
Hi. Good afternoon. What's your name?
My name is Ajo.
Ajo. Where are you speaking from?
In fact, I'm driving, so I don't even know where I'm speaking from, but I'm on the traffic road currently.
That's fair. All right. Go ahead. Doctor is here.
Okay, so doctor, I have two issues.
Right.
First and foremost, after I gave birth, my baby, I think after 3 months, I noticed. So I'm okay with the explanation you've given on the lump in the breast, but she had both breasts. Had lumps. Okay, and so I was okay because I had read about it and it was more in tune with hormonal changes. Blah blah blah.
Okay.
But Daddy got so, super excited and was like, "What is this?" So we had to talk to her pediatrician,
Okay.
who I think confirmed that it had something to do with hormonal changes.
Right.
Then she turned 1 on the 21st of this month, and about 2 weeks ago, I noticed that so after some time it went away, but about 2 weeks ago, I noticed that the left breast has got this lump again.
Okay.
It's gotten me kind of worried.
Okay.
I know probably it's just the changes, but it's better to ask than to assume.
Exactly.
Then the second thing is, as a doctor, I need an advice, okay?
Right, go ahead.
So Lexis, you're going to help me on this. Now that you're joining the fraternity, you're giving all those studios things that I don't really know of. I'm like amazed.
I hear.
How would it feel? Now put yourself in my shoes as a civilian who's not a doctor, who knows nothing about medicine. I attend to antenatal. I am almost due for delivery. And then all my specialists could tell me is, okay, I decide to travel out and have the baby abroad. Then all he could tell me in the face, like an expectant mother, is that you could have this condition. And I wish I would remember the name of the condition. But then he explains further and he says that, so you are likely to die in the air because your BP was high.
Okay.
And here was what happened. My BP went high because when I got to the hospital, before the BP was taken, I was made to climb 2 stories. And as soon as I got there, I wasn't made to relax, and the nurse started to take my BP. And I'm like, Doc, check my records from when I have started antenatal to date. Have I had any issues like that? He was like, no. You could have that condition because it is likely you die in the air, and that's where his word. And my husband gets so mad. So I am due to travel in like a week, and then I get out of his office and I'm like, you are done. I'm not coming back to you.
Oh.
And I hear him speaking on air, and I get so furious. Thankfully, I have my baby. I got to the States. I had my baby. Nothing happened to any of us. Swelling feet, just a little.
Okay.
How would you take this? What would you advise?
I mean, of course, the legal systems don't really work in this country, but what would you advise a sister?
All right.
Thank you.
Okay. All right. So Kwame, let me take the first question, which is the lump that you found in the 1 year old breast, or an enlargement of that breast. Most likely something that we talked about some time ago, which was gynecomastia, which is a enlargement of the breast. There are usually three age groups that we see this: in infancy, puberty, and then in elderly individuals. That's when the breast tends to enlarge. And the doctors were absolutely right. They're usually as a result of hormonal imbalances. So in that period, child is born all the way up to 1 year, there's still a lot of hormonal imbalances, and it can lead to the development or an enlargement of that breast. So in that age group, it's not entirely surprising. Same thing happens in puberty, where again you may have an imbalance between the sex hormones, and then you may realize that a lump is developing in a breast that ought not to develop. And then same thing in the elderly, where as you grow, the male hormones tend to go down, and then your female hormones relatively become more. So in that age group, I think that's exactly what will be happening. But it will always be good to take a look at it. Well, the second issue, I think what I got from it is an issue of communication. For all pregnant women, we do not take the issue of high blood pressure lightly at all. There is a very deadly condition called eclampsia, or we call it initially starts as pregnancy-induced hypertension, and then it can end up or be complicated by a situation called eclampsia, a condition we call eclampsia. And if your blood pressure goes up, we will not make any attributions to anxiety, exercise, being angry, or anything. Because if you do that, then you are taking huge risks. So it starts off as a sudden onset of elevation of the blood pressure. Your blood pressure could have been normal the entire pregnancy, and then it starts to go up at one visit. And the doctors have to take precautions and advise. And that is the word that I use. Our position is more of advisory. So after we've seen the patient, we would explain the condition to the patient, and then we would offer our advice. And then the patient then makes an informed choice. So I think the issue really had to do with communication.
Right.
But yes, I would have strongly advised against traveling by air. It's all a matter of risk. When we talk, we always talk about risk. Risk is not certainty. But if you want to take a certain risk, then we caution against it. But at the end of the day, the decision is left to the individual, and you make an informed choice. So the communication could have been better.
All right, let me see who's here. Hello?
Yeah, good afternoon.
Good afternoon, bro. Let's hear
I
you.
hope you are doing well.
I'm okay, thank you.
Yeah, this is Ajman Yusuf from tonight.
All right, Ajman.
I want to come out with a general question. Yeah, I'm suffering from a knee injury. Quite some years back, about 10 years ago, we were playing football, and I was defending a certain corner, and the guy pushed me, and my knee scratched on the side of the foot. So a certain woman used cold water to, treat me. Now, if I stay in a vehicle for a longer period with my knee bent, then I feel some pain. I do exercise a lot, and whenever I'm doing stretching exercises, when I throw this my right leg, I can hear some noise, blah, blah, in it. Somebody was even telling me that there's water inside. I don't believe it. I'm afraid of surgery, so what should I do? Secondly, I have a junior sister who is also suffering from menstrual pain. Before and during the medication, she experienced those pains, and we want an advice.
Right. Good. So question number one has to do with the knee, and I think, Kwame, you can relate.
I totally can, yeah.
Yes, and we would need a thorough history about the injury. And a lot of these injuries, the key thing is what happens immediately after the injury. See, the first 12 hours, 24 hours after the injury involving a joint. And the knee is one of the biggest joints, that we all have. And injury is a very, very complex joint. A lot of sports people, when you're playing sport, the twists and turns, it's a weight-bearing joint as well. So the injuries that happen to the knee have to be thoroughly investigated. You know, you can have a meniscal tear. You can have cruciate ligament injuries, anterior, posterior. So there are a lot of injuries that can happen in the knee. It needs to be investigated thoroughly. We need to have MRI scans of the knee for us to know exactly what is involved. You may need to have surgery to repair a torn ligament, and then considerable physiotherapy afterwards. Most of the time we get injured, we go home, put some hot water on it, wrong, and then go and use some leaves and all of that, different herbal preparations. So all I'd say is that he needs to see, one, a trauma surgeon, a general practitioner to start with, a regular doctor.
Yeah.
After that, possibly he would see a trauma surgeon or an orthopedic specialist, and then we'll take it on from there.
Okay.
It's been quite some time, but it can still be investigated and he can be helped.
Okay.
It is not necessarily surgery. There are so many different options, but we need to know exactly what the diagnosis is. Menstrual pain. I think one Anita Mirabel, they should come here. They should come and answer this question.
They need to answer this question.
You know, it's so common. A lot of people, women have it. Dysmenorrhea. It can be very, very terrible. I have a very good friend of mine who would sometimes skip school because of menstrual pain. That's how terrible it is. Does any particular thing work? No. That's the fairest answer I can give. No. Some women have informed me that they had terrible menstrual pain and then they have a baby and then it stopped.
Oh, okay.
Then I almost say, I wore it. Well, So sometimes after you start having, children, then it stops. For other women, they've had 10 children, it's still there. People try all sorts of concoctions. People try different techniques to deal with the pain. So we've got a range of medicines that we use, but I'll tell you that the response is not standardized.
Okay.
It works for some individuals, it doesn't work for others. So again, she should come in and then have a chat with a doctor, and then we'll take it from there.
AJ says, good afternoon, Lexis. Please ask Dr. Osafo to talk about polycystic ovarian syndrome, PCOS.
Right.
Because a lot of women are going through it without knowing the cause of their infertility. And I also want to know if it has a cure.
Right. So again, polycystic ovarian syndrome, it's something that PCOS, largely a hormonal problem. It's one of the causes of female infertility. So there's a problem with the ovaries. They fill up with fluid, and then you've got multiple tiny vesicles, fluid-filled balloons, little balloons, that then causes infertility in females. Typically, the woman tends to have a lot more male hormones than female hormones. So the woman with PCOS tends to be muscular. They tend to have hair, or they tend to be hirsuts, meaning they have hair in places you wouldn't expect hair in a female. So
like
they
the
have chest.
Like the beard?
Which some men find attractive.
Oh, do they?
When they have a little bit of hair strands in between, cleavage.
Like, baby, look at your hair, look at mine. Let's compare.
Let's compare, contrast. then it goes from there. Yeah, so they have hair there. They've got very hairy legs. They have to shave all the time. They've got beard, so they shave.
Okay.
Yes, they shave. And then they've got abdominal hair that climbs up. So we've got male pattern distribution pubic hair.
Okay.
So they've got female pattern distribution, which grows laterally. And then for the men, it comes up to the belly button. So the women who tend to have polycystic ovarian syndrome tend to be hirsuts, tend to be infertile, tend to have glucose intolerance. Some of them are frankly diabetic, and then have a deep voice and look very muscular.
Okay.
And it can be cured. It's got a cure. So again, you come into the hospital, would run a few tests, hormonal tests, do an ultrasound scan, and then we take it from there.
Okay. I think maybe one of these days we need to have a full conversation about it.
About PCOS.
And then,
It's very extensive, but yes, we should have a chat about PCOS.
Rukaya in Hacho says, good afternoon, Lexis. Please, I barely visit the loo. That's within a week, I can go only once.
Wow, that's serious.
Unfortunately, my son has the same issue. I try to take fruits and vegetables, but no change. What can we do about it?
Right. So constipation is also a big problem, and there are two types. Usually, we'll have what we call the functional constipation, where there's no obstruction. You see, the intestines are hollow structures. So if there's an obstruction at a point, then it's difficult, a mechanical obstruction, then you're not going to move things down. Moving your bowels, there's no standardized, pattern to moving your bowels. A lot of it depends on bowel habits. The domas in Presec, I mean, the states. So there was this guy, he's listening right now. He's in London, but he's listening, I know.
Oh, yeah?
We used to call him Sonny. So those who know Sonny will go home once a week, Bema camp.
To go and deliver.
To go and download the hot meal and come back. So if this becomes a pattern, then that becomes your bowel habits over time. And it was just because he just couldn't stand the state of the toilet.
But if he...
So sometimes patterns develop. Then diet also plays an important role. High fiber diet. So you may think that, you are changing your diet, but until you've seen a dietitian for us to really pick out the things. I always tell people that they're in contumely. People will tend to say, we are peeling the leaves and then we leave the stalk, that middle portion, and throw it away. Oh, but that's good fiber. So fiber produces bulk, and then bulk will help you move our bowels freely.
Okay.
A lot of people like bread in this country. My mom is a corporate, and then my big brother too. They just break their bread, sir, then it's finished. I haven't eaten that, and then it's finished. Well, bread also tends to cause a lot of constipation. So that's what we want to look at. But depending on her age, since he says her son, I think she should get a colonoscopy. Would want to make sure that there's no mechanical obstruction. It sounds like a functional constipation, but we would want to rule out any mechanical obstruction.
Yeah.
So you get a colonoscopy done, and then we'll take it on from there.
I got to be honest, we could do this all day. Yeah, because I have a lot of questions here that I'd have loved that we address, but unfortunately we're out of time. So if you can give us your contact so that people who have more questions can reach out to you directly.
Right. So the number is 0501 477 340. 0501 477 340.
All right. That's our drive, Dr. Yaw Osafo, CEO of Medicas Hospital. Thank you so much.
You're welcome,
Doc. And Medicas Hospital is in Medina, Firestone, behind the SG Bank, and in Mampong, Equiapim. Thanks a lot, and we'll find out what's happening in news now.